Auzubillahi minash shaitanir rajim. Bismillahir rahmanir rahim. Today we will discuss about the course and the relation of the four cranial nerves, which is also called trochlear nerves. Okay, the trochlear nerves, they are the nucleus of the trochlear nerves only present in the midbrain. Okay, this is the this is the totally black color is the midbrain. Midbrain. Okay. This is the nucleus of the trochlear nerve. One is the right nucleus. Okay, this is the right nucleus, which is red in color, and this is the left nucleus. These both nucleus are present in the midbrain. So the axon of the trochlear nerves, they are arising from these both nucleus, and this is the ventral side of the brain, and this is the dorsal side. Okay, this is the ventral side, this is the dorsal side. When the axon of the trochlear nerve release from the both nucleus, or arising from the both nucleus, they will move toward the back side. They will not move toward the ventral side, but they will move toward the back side. Okay, when they will move toward the back side and the path, they will here decussation occur. Both the axon will cross each other, will move toward the opposite side. Okay, here decussation occur of both axon. Decussation occur of both axon, which are arising from the left and right nucleus. Okay, when they decussate with each other, they will move toward the back side, toward the dorsal side. After this, the axon, the nerves will move toward the ventral side. So they will move toward the ventral side. Okay, ventral side of the midbrain. When they move toward the ventral side of the midbrain, they cross something. Okay, when they will move toward the ventral side, they will move between the two arteries. One is the superior cerebral arteries, and other is posterior cerebral arteries. Okay, so they move toward these arteries and running between these two arteries. One is the superior cerebral arteries and the other is the posterior cerebral artery. When they move between these two arteries, they will pass toward the cavernous cyanosis. So this is the cavernous cyanosis. Cavernous cyanosis. Okay, but here they will pass on the lateral side of the cavernous cyanosis. Okay, they will leave the skull on the cavernous cyanosis. Okay, after this they will move toward the superior orbital fissure. So this nerves will move toward the superior orbital fissure. Okay, superior orbital fissure. This is the superior orbital fissure, but they move toward the lateral side of the superior orbital fissure. Okay, when they cross the lateral side of superior orbital fissure, they will move toward the orbits of the eye. Okay, when they move toward the orbits of the eye, they are not supplying to the all extraocular muscles, but they only supply only one muscle of the extraocular muscle, which is called superior. This is the superior oblique muscle. Superior oblique muscle. Okay, this is the superior oblique muscle. Okay, so this is the diagrammatically explanation of tracheal nerves, of the four cranial nerves. They are originating in the midbrain and decussation occur. After this they will move toward the ventral side. Okay, when the decussation occur they move toward the dorsal side. After this they will move toward the ventral side. When they move toward the ventral side they pass between two arteries. One is the superior cerebral arteries and other is the posterior cerebral arteries. When they move between these arteries they will pass on the lateral sides of the cavernous cyanosis. Okay, this is the cavernous cyanosis. After this they will move toward the lateral side of the superior orbital fissure. When they move toward the lateral side of superior orbital fissure they will reach the orbits of the eye. When they reach the orbits of the eye they only supply the superior oblique muscle. Okay, this is the diagrammatically explanation of the tracheal nerve. After we will discuss in the next video about the nodes of tracheal nerves and the clinical representation of the tracheal nerves. Okay.